I am about 5 days out from having my biopsy done on my left breast for the two masses that were found. And I thought that I would just share an interesting thing that happened to me yesterday evening. It was really warm yesterday, and I think it was more warm inside than it was outside. And I just wasn't feeling the greatest. I have a really hard time with the summer for quite some time now. Um, my body just does not regulate my temperature very well. So I decided to go sit outside and just enjoy the temperature outside, as it was kind of getting to be like the evening hours and breezy and really beautiful. And I took a picture as I was sitting outside, and I'll post it right here. And the last year, I would say, I had noticed that one of my neighbors, I would see them frequently outside, and they didn't have hair. And it's a woman. And I wondered if maybe she was dealing with some kind of cancer, or maybe something like alopecia or something, that some autoimmune thing where it caused her hair to fall out. And just wondered what she was dealing with. Um, but I had never talked to her, and she was going for a walk, and as we crossed each other's paths, I said hi to her, and she stopped and started to talk to me about just so many different things in her life. But she was telling me that she was battling cancer for the past 5 years, and I had asked her if she minded sharing what kind of cancer she was going through, and she said that it was breast cancer. She said that she went for chemo for 5 years, and she ultimately ended up having her breast removed because it just wasn't going away. It was coming back. And so she ended up having that removed. And then the last appointment that she went to, it cleared, and she was okay at that point. Her hair is starting to grow back now. Um, but she still has to go in every so many months, she said, to have it checked out. And she still has like a port, I think that's what it's called, in her um, body, so that she can have like labs done and I think treatments and stuff if that's needed. And so I just looked at her, and so many different thoughts went through my head. She was just so resilient, and I just saw a lot of beauty in her. She said that she was 66 years old. And sometimes when I come across people, especially women around that age, and, they're out and about, or, just seem to be healthier, I guess, I think of my mom a lot, because my mom passed away a couple of years ago. And so this woman was older than my mom would have been, even if my mom were to still be alive. And just seeing her after going through 5 years of chemo, and having her breast removed and everything, and seeing this woman still going for walks, and like, I guess, so much healthier than what my mom was. It's just such a strange thing, I think, sometimes for me to process. And then this woman was sharing how she calls her mom and talks to her mom, who is 90 years old. And I think it's just such a strange thing to think about, and to come across people who are the age or older than your mom was when she passed away, and then to think that they still have their mom here even, and their mom is, like 90 something years old. Every once in a while I'll hear things like that, and it will just be just such a strange thing to think about, I guess, and how, none of us really know how much time we have here, or what our journeys will have in store for us, or what they will look like. along the way. But she just, shared so many things about her life and her experience, and how she really tries hard to take care of herself now and has like a bowl of fruit every day, and she loves her cinnamon raisin bread, and um, how important she thinks it is to like go for walks and all of that. And I just I I thought that it was interesting that I came across her and that she ended up sharing this with me right as I am about to go to have this biopsy done in about 5 days. And just thinking about, I I never I guess that every once in a while I would, think about breast cancer, but unless it's something that you go through yourself or come close to having some sort of an encounter where you have to, go in for a biopsy or something like that, I think it's one of those things sometimes where, unless you have to go through something like that yourself, you don't really think about it a whole lot. Or, you know, if you don't have like a immediate family member maybe who experienced it. I did have my paternal grandmother who had breast cancer. I was not close to that side of my family and did not end up meeting them until later on in my life. So, from what I understand, my biological father raped my mom, and that is how I came to be. And I did not end up meeting him or even finding out through paternity test or anything that he was my biological father until I was around the age of 18. And when I did, I realized pretty quickly that I wasn't going to be able to have a relationship with him. He's not a good person. He was not, I don't even like to use the word good person, because I think that, you know, we all have moments where we can be good people and we all have moments where we are not good people. Um, he was not a safe person for me to be around emotionally, for sure. Mentally, too, just not a safe person. Um, he was a pretty, um, he just would like verbally kind of dump all of his insecurity and failure onto me right off the bat, like just meeting me. So I didn't really feel safe or comfortable around him. Um, and because of that, I just knew that I wasn't going to hold space for that and wasn't going to be able to maintain a connection or a relationship with him. Thankfully, I had a really great stepdad in my life, but my biological dad, was just um, not what I kind of envisioned. Maybe all the years that I didn't know him as a child, I would kind of wonder, what he might be like. He was not like what I had imagined. Um, and I don't remember a whole lot about around that time in my life, and I don't know if that's because, it was a lot to take in, and I just have like fragmented memory around that time. So I don't know how many times I was around my grandparents from that side of my family, but I remember meeting my grandpa and my grandma from that side at least once. I don't know if I did more than that, but I do remember at least once being around them. It wasn't like a really long visit or anything like that. Um, and they seemed like nice people. Um, they were married all throughout their life, or all throughout I think my biological dad's life and upbringing. And so he seemed to come from a decent family system. But because of what had happened to my mom, I didn't feel comfortable really being connected to them very much. And I also didn't know them. So I just didn't really feel like it was easy for me, I guess, to connect to them. So I wasn't able to really know what type of breast cancer my grandma had. or, what age exactly she was at when she discovered that she had it. Um, I know that my biological dad ended up having prostate cancer, and he also had some kind of like a blood cancer called polycythemia vera, which I don't think was hereditary. But my grandpa, which would have been his dad, had bladder cancer. So his mom had breast cancer, his dad had bladder cancer, and he had prostate cancer and some kind of like a blood cancer. So that paternal side of my family definitely had a lot of like cancer kind of things going on. So that does make me a little bit nervous with this whole process and this biopsy and everything. Um, I don't really know how I think or what I feel at this point about it all, like what the results are going to be. There was a part of me, I think, that really felt like more strongly that it's hormonal and that I'm entering into perimenopause at this point in my life. And so, with my hormones being really out of whack and everything, that maybe that's what's causing me to have, like, I don't know, maybe like a fibroadenoma or something within my breast. And I'm still hoping that that's what it is. But there is a part of me that is really nervous that it is more than that. And just nervous, about the whole process overall. But I thought that leading up to the days where I actually have my biopsy done, I would just share a little bit, every so often of the process of it. And I thought that that was an interesting thing that happened to me, leading up to having this biopsy, where I was able to encounter this woman yesterday evening who shared with me her story. And so I thought that I would just share that and just continue to share as I go.
Had initially recorded this, I was rambling on quite a bit, so I decided to try to do a voiceover, and hopefully it works out okay this way. I thought that I would share a little bit of what I am doing to prepare before, during, and after this procedure. I have an immense amount of anxiety over it all. I am pretty nervous and scared. And I thought that I would just try to do some things to regulate my nervous system and help me to feel a little bit more comfortable and calm and organized, which always helps me to feel a little bit better. So I thought that I would share some things, and maybe it can help somebody else at some point in time have ideas for what to do to maybe help bring a little bit more comfort or calm to your nervous system. So I was told that it was important to try to prepare beforehand to bring a supportive bra with you, or a bandage kind of wrap to wrap around your breasts, because they are going to need extra support and be sore or hurting. I got this sports bra many years ago. It is the only one that I own, and the reason why I only wore it a few times is because it was really uncomfortable to me, just because of how tight it was and the amount of compression that it gives. So I figured I would take this one with me, and this would probably be a good option to use for this situation. And then I was told to wear a two-piece comfortable outfit, and I decided to just wear my favorite old sweatshirt, which if I could live in this, I would. So I thought that I would just prioritize comfort over everything else and wear that, as well as my favorite pair of jogging pants and just a plain white t-shirt, and maybe it can help me to feel a little bit better in the process, just feeling more comfortable. And then I also got a giant bottle of water for afterwards. because I have to hydrate anyway throughout the day a lot, and I know that when I come home I'm going to need to drink a lot of water. So I thought that I would get that for myself and just have it ready to go. And then I also got these electrolyte packets, which are my favorite ones, and they do not contain the sodium that I need, but they do contain a lot of magnesium, which I am low in often, and I can't tolerate a lot of electrolyte packets because some of them contain sweeteners that really irritate my digestive system, like fructose or sucralose. This one contains stevia, and it is one of the only ones that I can tolerate, so I get these often, and they are my favorite, and I decided to put that with my things to prepare for when I come home, and maybe it can help me feel a little bit better. And then I was told that you can take Tylenol beforehand to kind of help with any sort of discomfort or pain that might occur afterwards. I rarely ever take Tylenol. Even if I'm really sick or if I have something that really hurts, I just don't take Tylenol. But I decided for this I am going to. I got these many years ago when my daughter had her braces on her teeth and they were hurting her. She doesn't like to swallow pills, and I don't either. So I was happy to find that they have a powder version for like adult strength Tylenol, and these come in handy if it is ever necessary to take Tylenol. This is one of my favorite candies, and I haven't had it in a very long time. I am doing very good on the low FODMAP diet still and being mostly gluten-free. I would say my diet is probably 90% gluten-free and really no fructose at all. These do not contain fructose. They do contain sugar and glucose, which I tolerate okay, but I don't know, overall if this is going to cause an issue for me or not. But since it is such a difficult thing for me to try to go through, I thought that I would get this for myself as like a treat when I come home, and hopefully I do okay with them and it doesn't cause, me to have an issue with my digestive system. But I really like the texture of these. They are really good. I've had people make them homemade, but I actually prefer the baked ones. And then my favorite junk food, I would say, is Cheetos, but I haven't been able to have Cheetos for a long time because of the artificial colors in them. I have become increasingly sensitive to yellow number 5 and yellow number 6 for some reason. So I found these as an alternative. They don't really taste a whole lot like Cheetos, but they do taste somewhat similar, I guess. So this is what I decided to get for myself as like a salty snack to help me to get some sodium, and then just as a treat, I guess. They're made with avocado oil, which I also have been trying to get more snacks that have avocado oil instead of like inflammatory oils. And every time that I go on a rant about these things, I think about this meme and this guy. I don't really agree with a whole lot that he says, but a couple of the things that I've heard him say that I actually do agree with is that seed oils are not good and that artificial colors are not good. At least in my personal experience with my health journey, I have realized that it is just not good for me to eat them. So I figured I would get these and have these as like a snack when I come home. And then this is one of my favorite movies to turn on when I'm not feeling the greatest, and it just makes me feel a little bit more calm. It kind of distracts me and takes my mind off of things, and sometimes will make me laugh. I've seen it so much now that it doesn't always make me laugh, but it still does. It still is a good movie. It's one of my favorites. So I thought that I would have this ready to go and turn this on. And then my daughter got me this little Squishmallow many years ago for Christmas, and it is one of my favorite things. I rest my head on it a lot, and my knees as well when my knees hurt me at night. So I thought that I would have that ready to go. And then a couple of years ago, my mom had asked me what I wanted for my birthday. And I knew she wasn't going to be around much longer, so I asked her for a blanket. And she picked this one out for me, so I washed it and got it ready for when I come home, and maybe it can help me to feel a little bit more comfortable and just have a little bit more comfort afterwards. And I don't really like socks. I don't really like to wear socks a whole lot, but I do love these fuzzy socks. So it's going to be a little bit cooler on this day, I think, and I am going to wear these when I come home. And hopefully all of this just makes me feel a little bit more calm, a little bit more comforted throughout the process. And I thought that I would just share what I'm doing and why, and maybe it can give, like I said, maybe it can give somebody else an idea at some point of, some things to prepare to help feel a little bit better during this process.
I am probably going to wear compression socks or leggings to my appointment. I was given a prescription strength compression sock from my specialist that diagnosed me with POTS, and they gave me 30 to 40 mmHg compression leggings, and I thought that I would just kind of share why I cannot use these. So they just look like, your typical leggings, but when I try to put my foot in the leggings, I can barely get my foot in here. And I wish that I could, because I feel like they would probably help me a lot. But I don't know how people do this, and I would be scared to squeeze these on past, a certain point, because if I cannot get them off, I don't know, I don't know. I know that they're supposed to help with like circulation and everything, but my goodness, this is pretty much all that I can do. It's not going to be something that I'm able to wear, but I have a pair of just regular like tights, kind of, from many years ago, but they're actually pretty snug on me, and I would say compression like, I guess. So I am probably going to try to put these on, I guess, and wear these. So these, I definitely can at least get up on my leg a little bit. So they're very tight and, kind of compress things, but not so tight that I would be concerned that there would be a medical emergency from me having to put those on. They are just, I don't know how people do it. But that is also something that I think, going to do beforehand, is just make sure that I'm in a good place with my POTS and all of that. And I don't really know how this procedure is going to affect me in that kind of a way, if it's going to dysregulate me more and I'm gonna not feel very good from it. I guess that I will just update as I go and share, overall what it is like afterwards. I just got home a couple of minutes ago, and I thought that I would talk about what the whole procedure and experience was like. So at first, they brought me back to a little area or room where they talked about different things that were going to take place. They are supposed to leave behind a little marker, like a titanium um, piece of metal, like a really small piece of metal, to mark the areas where they biopsied from, so that in the future, when they give you mammograms and things like that, they know that they already biopsied from those locations. I, however, opted out of doing that because I had a procedure done after my last baby was born where I had a tubal ligation where I received titanium, they were called Filshie clips, which just destroyed, I think, my body overall. I um, think that I ended up having like a systemic kind of reaction to the clips because I didn't realize at that time that I had mast cell issues, and my allergist thinks that I am mostly sensitive and allergic to like um, metals, chemicals, adhesives, things of that nature. And it just seems to be getting increasingly worse as I get older, and I think that that kind of lit that kind of a fire within my body. So when, given the option to have more titanium or more metal put in my body, my allergist said, that's not a good idea. So I opted out of that. They really encouraged it. They really pushed for me to have it, but I decided not to. So I was this close to not doing it today, because I was given the like consent form to sign, and the risks were kind of highlighted in the overall pamphlet as being common risks. It said were things like heart attack, stroke, blood clots, pneumonia. And I was really confused because all of the information that I was given beforehand and through researching about it, I never came across anything that said that those were risks. So I was told that that's what I was signing, and I just couldn't sign it, and I started to get like an impending anxiety, even worse. And I told the nurse, I don't know if I should sign this. I don't know if I should do this. And I had asked them, how serious are the masses that were found? Is it something that I can just monitor and see, how it progresses over time, and if it gets worse, then maybe have it biopsied? And she was like, to be honest, I don't really know, and the doctor would know more if you want to talk to them. So I said, sure. So the doctor ended up coming in and was a very no nonsense kind of woman. Didn't really have patience, I could tell, for people who experience like a lot of anxiety or hesitation. And she just had said, I hear that you're having like questions, and ultimately I just need to know, are you going to do this or not? And I don't usually like it when people put me on the spot like that, but I understood, she had things to do and she needed me to make up my mind pretty much. But I was not really sure. I was having a lot of anxiety, and I had just asked her, is this serious enough to the point where I need to have this done, or can I just watch it and see what happens? And she said, these are not cysts. These are not like a benign cyst. This is something that needs to be biopsied. She said, I can't tell you until I biopsy it what's going on, but she said my recommendations are not going to change. And also really pushed for me to have like markers put in afterwards, which I said no. But she had said that it's not something that, is recommended to just watch and wait. She she couldn't change her recommendations. So I said, okay, I will do that. I need anxiety medication. I cannot do it without it. So they ended up giving me anxiety meds. I did not have a good experience with anxiety medication in my early 20s. I became suicidal when I was on antidepressants and anti anxiety medication. And ever since then, I never take it unless it's like absolutely imperative and necessary that I take it. I do not take it. I don't take it because I just remember, going through that time in my life and what it felt like, and I never want to experience that again. And, when I came off of them, I did not feel that way. So I just don't like anxiety medication. But for this instance, I knew I wasn't going to be able to actually go through with the procedure unless I took it. So I ended up splitting it in half because I knew half was going to be enough for me, which it was. It was more than enough for me. So I had that. I took that and I signed the papers, and then I went back into the room. They took the ultrasound machine and found the locations where the biopsies needed to be taken from. And then the doctor came in and again looked with the ultrasound just to make sure, the locations were right. They put like a little marker on my skin as to where they were going to make the incisions and where they were going to put the numbing, the lidocaine. They decided to clean me with iodine because I've been cleaned with iodine before for procedures that I had done in the past, and I tolerated that okay. So I thought that would be the best thing for them to use instead of something that maybe I wasn't really familiar with and I didn't know how I would react to it. So after that was done, they gave me the lidocaine. I was kind of bracing myself because I thought that it was going to hurt a lot, but it really didn't feel any worse than when you go to the dentist to get a filling and they give you like a shot in your gums. Actually, I think that might be a little bit more of an intense feeling than this was, for me personally at least. And they only needed to do a couple, few locations right away to get the area numbed. So they were biopsying from two different locations because there were two suspicious masses. So they went in with a lidocaine twice in two different spots and made two different incisions. Um, so the first one that they did, I could see the screen and I could see when they went in. What was really uncomfortable to me was they went in with a lidocaine to numb like the area inside of my breast where they were going to biopsy from. That did hurt a little bit more. It wasn't unbearable, but it was more uncomfortable than like the outer portion of the skin. Um, and then there was a lot of pressure, a lot of like tugging. There were moments where, when they finally reached the um, mass and they were biopsying, it felt a little bit like a pinching feeling. Um, Again, not unbearable, but it was like a pinching. And the machine made a very loud noise. And I would compare it to something like one of those, I don't know if they're like a Nerf gun or like one of those things that had like the little foam like things where when you click it, it like makes a loud noise, or like a bottle cap gun too. That's kind of what it reminded me of. If you know what that sounds like, it's like a just like a loud popping, clicking kind of sound, and it was pretty loud. And they took a lot of samples from both locations. I would say over 12 samples they took. So I could see on the screen when the needle was going in and where it was, and they were trying to explain it to me, and I was kind of going in and out of like watching and not watching because I think the medicine was kicking in for me, like the anxiety medication, and I was kind of
feeling kind of drowsy. And then also, I just didn't really want to look too much at it because it was going to give me more anxiety. I think I would occasionally like glance at it to see what was going on, but not keep my focus there. And so then after it was all done, it didn't take that long. So I would say overall, maybe like 15 to 20 minutes total for the whole procedure. Um, so then afterwards, the doctor had got everything kind of situated and let the nurse kind of clean off the area, and they ended up putting a glue on the incision sites. I will share a photo, like a cropped photo, so that there's no like images that are showing too much. I will show what the incision looked like here. So if you're kind of squeamish and stuff, maybe it's not, the best thing to look at. But one of the locations for sure I can show. The other one maybe is not really in that great of a place, but I will just share what one of them looks like. So the spots that they made the incisions at actually are not like really big or, horrible incisions or anything. They're just kind of like little minor scratches, like they look like little scratches. But I was told that I should right away be putting ice packs on them every 30 minutes to help reduce inflammation. I haven't done that yet, so I'm about to do that after this. And so then what they did was they put like layers of glue over that spot, in case they said that they were putting it on a little bit thicker in case I have a reaction to it and I can just peel it off easier. It burned, so I could feel it burning my skin, which made me a little bit nervous because I don't know if that's going to cause me an issue, um, a little bit later. So I did feel soreness. I would say on a scale of 1 to 10 with the numbing, it's still numbed right now as I am recording this, but with the numbing and everything, I would rate the pain or the discomfort at like a 1, 1.5. It was really hard for me to like get my bra on and everything. And every once in a while, when I move certain ways, I can feel it a little bit more. I was told that there will be discomfort and bruising. Some people take longer to heal than others, and ultimately, overall, it takes about 2 weeks to fully be healed from it. And they said that since I had this procedure done earlier in the day today, I should get my results within a couple of days. It is Memorial Day weekend, so it might take a little bit longer for me to get results, but I will update as I go along and my results and what I find out about it. And yeah, overall, it was something that I came very, very close to running out of because I was very scared of the risks and, all of that on the paper, but I decided to just go ahead and have it done and get it over with. So that is the experience that I had so far. It is now later on in the evening, and I thought that I would share a photo that I took of the incision site. I went to go and ice that area and noticed that actually they kind of went in at a strange location that was kind of actually on my side. So I will show a picture of it here. And to me, when I saw it, I just kind of thought it looked almost like I got bit by a ginormous, huge spider, some kind of like a spider creature or something because of the location and the way that the two spots kind of look. But it does not hurt. It is sore, but it doesn't hurt like I thought that it was going to. And I thought that I would just talk about that because maybe it can help somebody else who might be feeling, really
scared to have this done. I didn't look at the needle that they used, and I think that that was a good thing that I didn't, know what it looked like or looked at it, because I think that that would have scared me. I could see the needle on the screen as in the ultrasound image, but I didn't physically see the needle that they were using. And as I was watching on the screen, I watched them like retract the needle and put it back and try to find like different ways to get to the mass. And every time that I would watch it, reposition and retract and everything, I just kept thinking this is going to hurt really bad afterwards. It's when you just watch, your body being pierced by a needle over and over again, um, you just think that that is probably going to be painful and really bruised at the very least. Um, I can't really speak a whole lot on it because I know sometimes, the next day or a couple days later, it might be a little bit worse. So I will update when I get my results back how I'm feeling at that point. But I did have some images that were also uploaded to my files in my chart. One of the masses I will share right here. I had shared it in a previous video, but it was a little bit more, I think, distinguished in this image. So I'll just show what it looked like for me personally. And before I went to go and have this done, I took Tylenol, mostly because I was afraid that it was going to hurt afterwards. And I assumed that I was going to need Tylenol when I got home just because I thought it was going to hurt really bad. And I have not needed to take Tylenol since then, since this morning before going. So the worst part about it for me overall was the immense amount of fatigue that I felt afterwards, coming home. I just felt like the kind of bone crushing fatigue where you can barely move. That is kind of common for me, but it was like even worse than that. I think because of the anxiety medication that I was given, I just could barely move. I took a picture, I'll post it here. And that is pretty much how I just sat throughout the day. I couldn't do very much, not because of pain, but because of just fatigue and feeling really drained. Um, but that is it so far. And when I get my results in a couple of days, I will update what I find out and how I'm feeling at that point. I just woke up a few minutes ago and I received my results. It is the next morning after my biopsy was done. And my results showed that it is just a benign fibroadenoma. I was not that surprised to see the results be that. I was really anxious the whole time, thinking maybe it could possibly be something else. But like I said, my hormones have been so crazy, especially the last few years. And as much as I am told that I'm not in perimenopause, I do believe that I am in perimenopause. I am literally right on the edge of entering into my 40s, and I just feel like I have started it earlier. I will share what Google says about fibroadenomas and perimenopause right here. And so I do believe that with how crazy my hormones have been, especially the last couple few years, my body just all of a sudden made these fibroadenomas. I also think that because of my hypermobility and my connective tissues and everything like that,
I might have a higher susceptibility to having these fibroadenomas. Um, so I was suggested more recently to try to go on birth control. Because of my age, because I'm getting older, I really don't feel comfortable with that. And then also, I'm not really sure what hormones are exactly out of whack or which ones I might need more than others. So I'm a little bit hesitant to go on the birth control pill and maybe have it make my issues worse in the long run. And also just the risks and everything involved the older that you get going on that medication. I know they're starting to change the warnings on it now, but it still makes me a little bit hesitant, I think. So overall, it was really a stressful, very stressful experience. If I learned anything at all from it, I think that I just have a greater appreciation for women who go through breast cancer, like actual cancer, and have to go through all kinds of treatments and removals of your breast and everything like that, because the biopsy itself was really, really stressful. I'm happy and thankful that that's all it is, a fibroadenoma. And um, I just thought that I would share my experience and what I learned from it all. So that is it.